A good candidate for lip enhancement or augmentation procedure is a patient that has thin lips or that even want just a little more definition to the lips. It doesn't need to be a lot of volume augmentation. It can vary actually depending on the patient's goal and anatomy. Let me just take a look at the lips. I think it would be nice to do something at the corner of the lip too. She has a little bit of downward of the lip in the corner, and that's gonna just lift a little bit there too. A lip augmentation is usually done by injection of a product in the lips, most commonly hyaluronic acid or fat. A lip lift is used for patients that have aging of the upper lip and it becomes longer. So it covers the upper teeth and it gives the patient an aged look. So when we inject a volume into a very long and thin lip, it looks odd, and that's not the right procedure for that patient. So a lip lift is done by a small removal of skin right under the nose, and then we lift the lip, exposing all the lip that is actually inverted with aging. So most patients have a good amount of lip that just from aging has disappeared. We use most often hyaluronic acid for lip augmentation. They are very soft fillers that can be used for volume enhancement or also for definition. So patients that have already good sized lips that just want a little more definition of the edge, or patients that have very thin lips that want to have more volume to the lips, for those kind of patients, hyaluronic acid I think is ideal because it is reversible, so we have the chance to dissolve it if the patient doesn't like. It is temporary, but it also ages well with the patient, so it does absorb as we age, so that's a great product in my opinion, so it's natural. Other products that are used are also fat grafting, so we can remove fat from the patient and prepare as a filler and inject to give mostly volume than definition. So fat can be a good option for patients that want to use their own fat for augmenting the size of the lips. The downtime for a lip injection is usually a few hours to a couple of days. The most common side effects are swelling and minimal bruising. We recommend ice and anti-inflammatories if the patients have a lot of swelling, and that can happen. Everyone is different, so we cannot really predict who is going to have minimal or a lot of swelling, but it's usually just a couple of days. Now for a lip lift, is usually a week to 10 days because it is a small surgical procedure, so we have stitches to be removed between 5 and 7 days. And during this first week, it's common to have swelling and bruising as well, a little bit more than just with lip injections. So we recommend that all the patients prepare accordingly, and usually anti-inflammatories and ice help prevent extra swelling and bruising.